Hi, this is Dr. Bharadwaj. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics related to autism. There is a hormone known as vasopressin. Vasopressin is an important hormone that is deficient in autism kids. So we will look deeply into it. What is vasopressin? What happens in some subset of autism kids if there is deficient vasopressin? So autism is a disorder. Okay, it is a spectrum disorder. It is spectrum in all the aspects. There is no one cause for autism. There are hundreds of causes. There is no one symptom for autism. There are hundreds of symptoms. In the same way, there is no one pathology for autism. Pathology means what happens in the brain or body of a kid who is suffering from autism, which is different from normal kid. That is known as pathology. Studying about the wrong things in a body is known as pathology. One of the changes is low vasopressin levels in the CSF, cerebrospinal fluid. We will look deeply into it. What is this CSF? What is this vasopressin? What are the functions of vasopressin? What happens when the vasopressin hormone is deficient in your CSF, and how to tackle it? How homeopathy can help you with this regard? Let's go to the board. Let's discuss autism spectrum disorder, the two vasopressin in autism spectrum disorder. Low vasopressin in CSF causes autism. Now we will look deep into this vasopressin. What is vasopressin? Vasopressin is a chemical that is released on our brain. This chemical is commonly known as hormone. Okay, where it is produced and where it is saved. Okay, this is the brain. See, you have seen two parts, right? This part of the brain is known as hypothalamus. Okay, this one is hypothalamus. This one is known as pituitary gland. Vasopressin is produced in this part of the brain, that is hypothalamus, and it will come through this trunk. There is a small attachment to the pituitary, right? It comes like this and it is saved in the posterior pituitary, back side of the pituitary gland. Here vasopressin is produced and it is saved here. Then what happens? Once it is done, when it is released, vasopressin is released in two conditions. One, when the body is dehydrated. When the body is dehydrated, when you don't take much water, when you go in sun or there is large amount of loose motions, all the water from the body is going out, then this vasopressin is released. Vasopressin releases and it retains the water. It will stop urination. It will stop the loss of water from the body. This is one of the functions of vasopressin. Everyone knows. What is the next function? Next function is stress. When there is stress, physical stress or physiological stress, emotional stress, whatever the stress it may be, so it helps in the stress mechanism. During stress, what happens? Adrenaline is released and cortisol is released. These are the hormones that release due to stress. It enhances those hormones. It will also help in the stress mechanism. These are the normal functions of vasopressin, and we will go deeper functions into vasopressin where there is new research has come on vasopressin. We will go deep into it. You can see here, this is the brain. On brain, it acts on kidney when there is dehydration and stop the urination. It will retain the urine. It will not empty the bladder. It will not put the urine into the bladder. So body fluids are retained. Body will not throw out excessive fluids when already there is dehydration. That is done by the kidneys. Means vasopressin is acting on the kidneys. When it acts on brain, there are different parts of the brain where vasopressin acts and what it does. We have already studied fluid retention and stress response. Next one is there are personality changes. For example, protection. What is the main purpose of a male in most of the animal kingdom, including human being? He has to protect his tribe and he has to protect his family. The instincts for protection comes from vasopressin. If you have good vasopressin, males tend to protect their family and tend to take care of this family. How they can take care? Males tend to protect their family in two ways: by showing aggression. When some enemy comes, they will be aggressive, they will have their territory, they will ensure that their family is safe. One more thing is they become submissive. So in situations where they cannot fight, they will be submissive, they will be cool. You can see two types of people, right, in the world who try to protect their family. Some people are aggressive, still they protect their family. Some people are small, docile, some people are submissive, and they ensure that their family is protected because no threat comes to them when they are submissive. Whether it is aggression or submissiveness, it doesn't matter. Vasopressin tries to protect your family. And also fear conditioning, so it reduces the fear. These are all the common. Next, coming to especially autism, it acts at the communication level. When there is no proper communication, when the person in the family is indifferent to the kids or indifferent to the wife, it is a problem, right? So vasopressin also helps in social communication, social understanding, and social bonding. When there is good vasopressin in the blood, so what it does is it helps in the bonding. So the main problem with autism kids are they are indifferent to the family, so they don't show much emotions, they don't show much communication. When the vasopressin is low, these type of symptoms will occur. So mainly vasopressin is the connecting hormone, bonding hormone, especially in males. It is also present in females. In females, oxytocin is a bonding hormone, a main bonding hormone. In males, it is a vasopressin is a main bonding hormone. This is all latest research. Next, I want to tell you a small study that is done on wolves. One scientist went to forest and observed the pack of wolves. So in the pack of wolves, there will be different families, right? There will be 10 or 15 families in a pack. She observed that some male wolves are taking care of their family well. They are protecting their kids. They are gelled with their spouse. All those things are happening. Some male wolves are not taking care of it. This scientist got a doubt and took the blood samples and especially the CSF samples from the brain. We will look into what is CSF and tested it. The wolves that are not taking care of their family have low vasopressin in their CSF. What this scientist done is she injected vasopressin into those wolves. Those wolves' behavior immediately changed. They started taking care of their family. They have started communicating to their kids. So all these have happened. Basically, what it does is low levels of vasopressin means you are indifferent to your family, you are not communicating, you are not protecting. This she has seen in wolves, and she has taken the same study in the autism kids. She has taken the samples of cerebrospinal fluid from autism kids and she has tested for vasopressin. Most of the autism kids who are deficient in social communication has this defect. Okay, we will look into that. Autism kids low vasopressin. You can see this is a diagram of the brain. These blue lines you can see, right? This is known as cerebrospinal fluid. Cerebrospinal fluid is a liquid which is in the brain and around the brain, which acts as a cushion. So brain is not a solid structure that is present in our skull. Rotating that brain, well established fluid, so that it can prevent the shock, whatever it is. So there are other functions of cerebrospinal fluid. One is the brain is not a solid structure. It is bathed in this cerebrospinal fluid and it is present in our brain. This cerebrospinal fluid is surrounding the brain, and also there are some empty spaces in the brain. Those are known as ventricles. Even in these ventricles, this cerebrospinal fluid is present. What happens if these cerebrospinal fluids contain low vasopressin, as in autism kids? One is diminished emotions. Kids will show low emotion. They will not show emotions and they will not understand emotion. For example, if the father is angry, they are not able to understand. If they get irritated, they are not able to show anger. In the same way, sadness or disgust or happiness or whatever the emotion you say, emotion is diminished in them. There is no back and forth conversation. If you try to have a conversation with normal kid, he tries to play with you and he tries to converse with you. But autism kids, they will not initiate the conversation and they will not take the conversation back and forward, and they will not show much social interest in socializing. They will not show interest as well. They are not able to show non-verbal gestures, and also they are not able to understand the gestures. For example, if the father is angry, you can see his posture like this, or normally kids can understand the change in the tone of the voice when the father is showing non-verbal communication. They are not able to show non-verbal communication and are not able to understand non-verbal communication like gestures, posture, or tone of the voice. They are not able to understand. Next one is abnormal eye contact. Some kids will not have eye contact, some kids will have abnormal eye contact. These are all due to low vasopressin. They are also not interested in making friends. When the kid has low CSF levels, these are all the symptoms. These are all the symptoms corresponds to the autism symptom. There are three main criteria for autism. First one is communication problems. Next one is repeated restrictive movements, and third one is hyper or hyposensitivity. So there is no change in the hypo or hyposensitivity or restricted repetitive behavior due to low vasopressin. The most important thing that is affected when the kid is low on vasopressin is communication problem. How do you assess that this kid have autism due to low vasopressin. By symptoms you can observe. If the autism kid is urinating more, is more thirsty, and he is drinking more water, and he is bedwetting at night, these symptoms mostly corresponds to low vasopressin. There are other reasons for autism. One of the reasons is low vasopressin, because if there is low vasopressin, body cannot retain the fluid, so he will always urinate. In the same way, the body cannot withhold the urine at night, so he urinates at night. Body cannot withhold the urine, he goes to urination multiple times, and he drinks water. So with all these symptoms, if he has communication problems along with urination problems, hyper urination, then you can consider that this vasopressin is causing these defects. His pathology, his autism is due to low vasopressin levels. This autism kids patient has to understand. Now we will look, when the patient is deficient on communication problems and he is urinating more, this type of deficiency is due to low vasopressin. How homeopathy can help you, we will look into it. Homeopathy can prevent these symptoms, communication problems and urination problems in autism kids. When you start taking homeopathic medicine, these symptoms progression will stop. In some of the cases we can completely cure autism, but in most of the cases we can relieve the symptoms of autism. So communication problems, or restrictive repetitive behaviors, or hyper or hyposensitivity, and also urinary problems related to autism can be relieved to a greater extent with the use of homeopathy. Homeopathy is completely safe. There is no other medical system in this world which is as safe as homeopathy, because there are no side effects in homeopathy. There are almost zero, 99.9%. They will not have any side effects. And coming to efficiency, compared to any other treatment, okay, you take Ayurveda, Unani, Allopathy, Siddha, naturopathy, homeopathy is highly effective, and the success rate is more. Some of the cases we can completely cure, but in most of the cases we can give good relief. And this is timely. It is not that it takes lot of time to reduce the symptoms, but it will be timely. Within 1 or 2 months or maximum 3 months, you will see good results. And coming to what is the specialty of homeopathy, you know that autism is a spectrum, right? There is no single cause for autism, multiple causes, because it is a spectrum. And also there are multiple symptoms of autism. It is not one single symptom. Even symptomatology, it is spectrum. And also pathology, there are different pathology for autism. If you take 10 different kids, in 10 different kids, autism is due to different pathology which is occurring in the body. See, biological basis for autism is different in different kids. Okay, it is individualistic there. Each kid, if you have 10 kids, the cause for one kid of autism is different. For next kid is different. So in the same way, it is a spectrum. Homeopathy has a spectrum of medicines. In this particular case, what is the problem? It is communication problem and urination problem. There are specific medicines in homeopathy which can tackle both communication and urination. For example, there are 5,000 medicines in homeopathy. Out of 5,000 medicines, if you take different concentrations of those medicines, it is going up to 50,000 medicines. A homeopathy doctor has 50,000 medicines to select for your kid. Among these 50,000 kids, homeopathy doctor will select 2 or 3 medicines and give it to your kid based on his needs. So not every kid will have urination problems along with autism. Autism can be different in nature, but there are specific medicines in homeopathy they shall be given when they have communication problems along with urination problems. Only that medicine is given to your kid. And also there are a lot of variations in this. If I get 100 autism kids, I will give 100 different medicines for 100 different reasons. That's how sophisticated is homeopathy. That's the reason we have good treatment in homeopathy for autism. If your kid is suffering from autism, homeopathy is the best choice for you. You can contact us in two ways. One is online and in person. If you would go with online, you can make a video call or audio call. You can share the videos of your kid, or you can show the kid directly to us. If you have any investigations already done, you can share with them electronically. And if you want to reach out in person, we have multiple branches. Inquire about the nearest branch and consult our doctors. How do you contact us? +91 is the country code, 7997 101 303 is the phone number. You can either call or WhatsApp us. And also you can reach us on www.fidicus.com. So what your kid gets at Fidicus Homeopathy? These are the 3 important things your kid gets. First one, doctors. The doctors that are going to see your kids are highly passionate, qualified, knowledgeable, experienced, competent and compassionate. And coming to the treatment, We use only high quality medicines, best in segment medicine. Whoever in the world is making best homeopathic medicine, we get the medicine from them. And coming to infrastructure, we use latest infrastructure to select the medicine and treat the patient. And Fidicus Homeopathy is the first and only homeopathic hospital or a clinic that is using artificial intelligence to handle autism cases. And why Fidicus Homeopathy? There are a lot of homeopathy doctors and chain of clinics, individual clinics. Why Fidicus Homeopathy? At Fidicus Homeopathy, you have the highest chance of health. We have the highest success rate for autism compared to any other homeopathic doctor, and transparent treatment. See, there are a lot of treatments available for autism. Put to you all the treatment, all the variations of the treatment, and ask you to select which is best for your kid. We will not force you in any regard. And coming to the personal care, we use technology in the back end, not with the patient. When the patient comes, it is completely personal. Our doctors will take personal care of you. Our staff will take personal care of you. It is not that we use technology for handling the patient. It is more human touch than machine. That's the reason. Consider Fidicus Homeopathy for your kid.